everybody. This is Brittany Jennings coming to you from the Seniors Blue Book Live. And today we're doing a very special interview with one of our partners, Bluestone Physician Services. And we have Dr. Phil Fioret with us here today in the house. The original, I'm being told, Dr. Phil.
Be careful with that.
So actually we're on the Dr. Phil show today. But I wanted to be able to introduce Bluestone Physician Services to everybody out there, our viewers, including professionals, seniors, caregivers, family members, to be able to really dive into what Bluestone does, because they provide an amazing service that's extremely beneficial and enhances the quality of life for seniors. And that's what we're all about here. So I wanted to go ahead and introduce Dr. Phil. Say hello.
Yes, hi. Good morning, good afternoon.
So tell us a little bit about yourself.
So I'm a family physician, trained in Canada, the University of Toronto, board certified, moved to the States about 25 years ago. So I'm about 40 years into my career now. Just do geriatrics, so really I consider myself a geriatrician per se at this point. Retired a couple years ago to Florida, and that lasted about a week and a half, and then jumped into this job with this company that at the point I didn't know much about, called Bluestone.
Okay. So tell us a little bit about Bluestone and just the company in general,
Sure.
The services that you provide.
So it was actually created by a family doc up in Minnesota who was a traditional brick and mortar physician. And one day a patient showed up with a sticky note saying, "Send back when done." Which done what? So it came out it was someone from an assisted living home.
Okay.
And he ended up going there to say, what's going on? And they were shocked that someone actually came to their home. It came out that he soon had the whole home's patient volume to him, and he got more homes, and eventually he had to close his brick and mortar office and just became a physician who did house calls in assisted living.
A mobile physician.
Yeah, and that soon overwhelmed him, and he had to have some assistance. So he got some nurse practitioners involved, and eventually he was doing it throughout the state, and moved to Wisconsin, and then where to go next is, his wife was from Tampa actually, so they came to Florida. I came in about 2.5 years ago, 3 years ago now, when they were expanding down into the Sarasota area, and the idea is that this assisted living market is really one that no one takes care of as far as providers, or it was really an underserved market. So the concept is, hey, wouldn't it be great if, because so many of these residents here do have trouble getting around, or their family are not local, and transportation is an issue.
Absolutely.
Wouldn't it be super if someone came to them? And I say, before I started this, I have done house calls in my career, but it wasn't something as a physician I did very often because it's very time consuming. But if you're designed just to do that, which is what Bluestone does, so we come into a facility, and our commitment is we'll see all our patients every 4 weeks, once a month.
Okay.
And in some facilities where we have lots of patients, that requires us to come in every week or twice a week, even in some of the bigger ones. So we're here frequently, and our goal is, if you've had a great month, we'll check on you. We reorder all your medicines for you. If there's lab tests that need to be done to monitor, or if something comes up, we can do that. We can even order x-rays, simple things. I can't do a CAT scan, obviously.
That will come here to the community as well?
So there's mobile x-rays, so we can do labs. And then we work very closely with other professionals like physiotherapy, home health, skilled, who provide skilled nursing, occupational therapy, speech therapy, or whatever other service may be required to help maximize the services being delivered to that person. And by being in there routinely and regularly and getting to know the residents, some months everything's great and I don't really have to change anything other than just to make sure. Others, something has happened, and so you adapt accordingly, or you're following up on something you did previously. So our goal is to kind of keep you between the curbs.
Yeah,
and not let
it's
you,
like a one-stop shop within a community.
Absolutely, and I see my role coming in, like I say, with almost 4 decades of experience, is just someone who can say, listen, not my first rodeo, if you will, this may be a good idea, or this may not be, but here's your options, and let's go from there.
And you're such a huge asset, because as we all know, from previously I worked in a community that everything happens like at 4 o'clock on a Friday, So sometimes having that, the ability to communicate so quickly with Bluestone and, you know, providing that service here, you get orders or medications things so much quicker than you would with maybe an outside physician. So it's such a valuable service, invaluable.
That's a great point. I don't think we could design a crazier system than the American healthcare system, unfortunately. And communication, you know, it's 2019 and only physicians are dumb enough to still use fax machines. I mean, it's very outdated. One of the probably biggest strengths of Bluestone is they have created their own proprietary, it's a portal or a bridge, we call it, the Bluestone Bridge. But basically it's a web-enabled communication tool, and the homes are able to send me, in essence, an email, and if it's urgent, they can mark it as such, and it bings out to my phone that this is not just a routine but urgent, so depending on the priority. And I can read it wherever I am because it's available, the app's on my phone.
The families can connect with you that way?
So the nice thing is I can send orders back, and there's a communication between me and the home, and wouldn't it be great if the families knew the dialogue that was going on? So they've expanded it, so yes, the family can be on there so they can read it, and they can even send emails as well, which, you know, I will respond to. And it allows, you know, a much better way of letting every right and left hand know what's going on. So it's that is probably the biggest tool that, when you think about it, it's so basic, but sadly, as you know,
it's so needed.
Absolutely,
as you
it
said,
doesn't exist.
Communication is everything,
right?
And that's where you can see things drop. So if you have this portal on all sides to be able to connect everybody and ultimately provide that quality of care, then that's
right.
Amazing.
Yeah, well, my terms exactly. So I'm a huge fan of it now that I've used it, and when we go into a facility, they sometimes are a little hesitant. Well, you know, what is this? It's new. Where's the fax machine? But once they get on board, you know, most of them say, "Wow, this is so much easier." The nurses love it. You know, I love it. It allows that communication, like I say. So it's a. I almost wish, and I almost think someday everyone's going to be on something like this. When that'll happen, who knows?
You're ahead of the curve.
In this sense, absolutely, absolutely. So combining that tool with the regular visits